Hi, welcome to Aladin show. I hope everyone's doing well wherever you are. Good morning, good afternoon, and good evening. So I hope you're doing well. Actually today I'm here in this clinic, Chinese clinic, and we thought we'd just share a bit about herbal medicine, a bit about acupuncture, and how it could benefit you out there. If you haven't experienced it, watch this show and you will learn something that will really help yourself or a member of your family. I'd like to introduce to the doctor who actually runs this clinic, Dr. Lee, and he has been working with clients for many years, and he's been helping people with a lot of conditions. I'd like to welcome Dr. Leo, who's actually his clinic here, and who's been helping many patients for a very long time. Welcome, Dr. Leo. Thank you for allowing us to use your clinic.
Yeah.
As you can see, I'm sure a lot of you could see a lot of kind of herbal medicine in the background. Dr. Leo, how long have you been working as a herbalist and acupuncturist for?
I graduated from Chinese Medical University from 1991. Now I work as a traditional Chinese doctor. Is 28 years.
28 years, that's a long time.
It include 18 years in China.
18?
Yeah, 10 years in the UK.
Oh, 10 years in UK. So, so you came here 10 years ago, and I'm sure you've been kind of helping so many people. Were you in Glasgow? I mean, your clinic is at the moment in Glasgow, but have you been always in Glasgow the last 10 years, or were you previously somewhere else?
I used to work in London for another 3 years.
Okay.
I worked in Glasgow 6 years.
Okay.
Yeah.
6 years. So what kind of people who come to see you with what kind of problems so for example, do you get people with like back issues or shoulder pains or arthritis? Can you treat those patients or people?
Honestly, different patients come here to ask help, but most of these patients they suffer some problem. Local doctors they can't cure them, or their treatment not work properly.
So obviously, somebody's going to a GP or something, and most people get some kind of medicine or some
Yes.
tablets or whatever. So, and it's basically kind of hiding the core of the issue, whereas you try to kind of treat the root really of
Yes,
the
yes.
issue. Yeah.
Like my patient, a big part is suffer different pain. For example, headache, migraine, neck pain, shoulder pain, low back pain, or different arthritis. For example, yesterday I have a patient. She suffer gout arthritis. Her foot swollen, can't walk, and his both fingers swollen, very painful. She take 2 different painkillers, still not work. So she came here ask help. After first treatment, her pain reduced a lot.
That's really good. So she's obviously tried quite a lot of few things. So do you help people with diabetes? You do help with people, women who come want to get pregnant, for conceiving, and obviously they might have issues. I know that you have helped ladies that came through the door, and after
Yes, we do.
few treatment.
We have a lot like diabetes, infertility, IBS, anxiety, yeah, different.
Stress.
Yeah.
Stress is the biggest killer, but stress. And so I know that I came in a few days ago, and I know that when I had a treatment from yourself, I could see a massive difference just after 10 minutes of the treatment, feeling very light and very relaxed and everything. But I could see that you've got some herbals back of you here, some interesting herbals. So how when somebody comes through the door, how do you examine the patient first?
As a traditional Chinese doctor, normally we need to check the patient's pulse. From the pulse taking and the tongue reading, I can diagnose what problem the patient suffered, and I can, after that, I can decide how to do treatment.
Okay.
In Chinese culture, everything we call the yin, include the yin and yang, two part. If yin yang balance, it's okay. If unbalance, it causes problem.
So yin yang is basically body's energy. Is it qi? Is that what you call it? It's like energy. So if the yin yang mean is that what you mean? It's energy.
It's different. For example, daytime is yang, nighttime is yin, woman is yin, man is yang, outside is yang, inside is yin. Same thing in your body. Include yin and yang too. If yin yang unbalanced, it causes problem. For example, if yang is higher, the people always feel hot. But if yang deficiency, people easily feel cold.
Oh, okay.
So we need a yin yang balance.
Okay.
If unbalanced, I rather try rebalance.
So it's balancing the body. So most of us is like, if you're unbalanced, that's where our issues happen. We have health challenges if our yin yang is unbalanced. So it's like to say man, woman. Kind of thing. Yin yang, you need a man, is a woman. It's like so there has to be a balance going on here. So I could see that you've got some herbals back of you there, and so it's very interesting. How many herbals have you got? In this clinic, how many have you got here?
At here, my clinic, because it's a small clinic, only more than 200 different herbals.
200?
But if in China, in my hospital, it should be more than 400 different herbals, include some animals, for example, like snake. But in the UK government don't permit we use that.
All right. I don't want to see. So I could see that you've got flowers and roots and everything here. So is majority of the herbals here come from China or from other parts of the world?
A big part from China, a small part from different countries like Iran, Iraq, like Pakistan, like that.
Okay. So when you're when you examining the patient and then you actually decide what herbals to use to help, I'm presuming that you use different types, like mixes, to make a kind of a concoction kind of thing, or a medicine?
Yes. After diagnose what patient suffer the problems, then I need to decide how to do treatment. After that, I will prescribe some herbal medicine. Normally, the prescription include nearly 10 or more than 10 different herbals to treat different problems.
Okay. No, it looks very, I mean, I'm sure it looks very interesting. You've got so many colorful roots and leaves and things like that. So if you gave your patients some herbals, when they take it home, what did they do? How did they make it?
We have different type of herbals. You say this is raw herbals. When I prescribe the prescription, I will take the medicine for patient. They need to bring to home to boil it. The process nearly more than 1.5 hours.
So they take it home and they boil it, and it takes 1.5 hours. And I'm sure it doesn't taste great, and it doesn't really smell great, because I have tried it myself.
It's true.
And it's not obviously for everybody. But you do have an option if people if they don't have the time to boil it, or you do have the powder form as well.
Yeah, of course. Here have a lot of young people. They are busy, have no time to boil it. So I read some herbal powder, herbal tablet. The herbal powder like the coffee. only use them hot water, stir it. Yeah, can drink it.
Drink it,
It can save a lot of time.
Yeah.
And easily to take.
So, so if somebody doesn't want to boil the actual herbs out there, you've got the powder form. They just put it it's like coffee. You put 1 or 2 spoons and put hot water and drink it.
Yeah. When I read the herbal powder, I will calculate how many grams patient need to take. And I have here we have the small spoon.
Yeah.
Like this is 1 spoon is 1 gram.
Yeah.
So I will give the spoon to patient and tell them how many grams they need to take.
Okay, so they get a spoon to measure it,
Yes.
and then they know exactly how much to take. No,
Yes.
thank you for that. It was very interesting to know about herbals. But we're going to obviously talk about acupuncture and give a kind of insight about acupuncture, and we'll go into the room and
Okay.
maybe show us how you
Okay.
what's the process is.
Yes. Go to this way.
Yes. So, what is acupuncture?
How to say it? I think I can say like this. Acupuncture is a treatment way to cure the patient problem. Acupuncture originated from ancient China. For example, in ancient, some people suffer stomach pain.
Yeah.
But suddenly, when they fell down, hurt their leg.
Yeah.
When hurt their leg, stomach pain disappear.
Yeah.
So ancient Chinese people find, on the leg, some point can cure stomach pain. After a long time, thousand years clinical practice,
Okay.
Chinese people find a special system. Every body have 14 lines, all called meridian.
On the meridians.
Yes,
Okay.
on the meridians have different acupoint. Stimulate different meridian can treat different problem. For example, here have a meridian we call the stomach meridian.
Yeah.
On this meridian, nearly all the acupoint can do treatment for stomach digestive system. Another way, a different meridian connect different organs, so it can treat a different problem.
Okay, so there's it's a system in the body. It's called meridians, and all are linked to different organs. And you can actually, where you're saying if somebody's got a sore leg or a knee, it kind of you could actually treat it in some other parts of the body, because it's like a railway station
Yes,
that goes
yes,
like that.
yes.
So wherever you put your
Yeah.
a needle, then it seems to affect the whole body, where that part of the system.
According to traditional Chinese medical system, meridian serve as a pathway for support blood, nutrition, oxygen, blah blah like that.
Okay.
If your meridian blocked, the muscles, tendons, even organs can't get enough nutrition, blood, oxygen. This causes pain.
Okay.
What I should just unblock the stagnation.
Yeah.
If the meridian flow good enough, the pain will automatically disappear.
Okay, so we've got a volunteer here, and he's got blood pressure issues and a few other things. So you want to kind of show us kind of how you use the needles and where would you put it?
Okay, no problem. I can do different acupuncture,
Okay.
scalpel acupuncture, traditional body acupuncture, and abdominal acupuncture.
Yeah.
Today, I just show
That.
abdominal
Okay,
acupuncture.
let's do it. Let's see. That's very
Firstly, I
interesting.
need measurement the size.
Okay.
After that, I need to calculate where is the key point.
Okay, let's do that.
I make marks use my nail. Then I take 23rd centimeter, 23rd.
So it does affect. I mean, that's why you need to measure, because everyone's weight, it's different sizes.
Yes,
So-
different people, different size. So, but every people from belly button to the bone is 5 inch.
Yeah, 'cause
So even bigger or shorter
Okay,
doesn't matter.
that's
I just check the size, then calculate
Okay.
about 1 inch and where.
So the meridians is underneath the muscle, or just the skin, because if somebody's put on weight, obviously you're measuring. So if so it does affect if somebody's meridian changes, if somebody's
Meridian
bigger.
under the skin, but up the muscle.
So that's why you need to measure it. Yeah.
Because the number I use a long time, when I go to the result, I can automatically know where is it.
Okay, thank you.
How about your sleep?
Yeah.
Sleep, yeah, I sleep okay, like 5-6 hours.
Oh. Any pain?
Okay,
Okay.
good.
For high blood pressure, I need a water. Okay, like that. No pain, yeah?
Yeah, that's okay.
That's good. Enjoying the relaxing it's very relaxing doing this, because I had it a few times myself, and you can't really feel anything. Just maybe slightly later you just notice slightly, but other than that. So does it depend on how many you put in? Obviously it depends on what you're treating. So you could have, how many needles do you put in? I mean, you've got about 5 there.
Yes, different problem. I need to stimulate different meridians.
Okay.
For example, this is Ren meridian. This can improve the organs function. For example, if do treatment, this is the stomach meridian.
Yeah.
If this, maybe you can find this is a little deep.
Yeah.
This is a little light.
Uh-huh.
This is different useful.
Oh, okay.
Do treatment.
So if somebody's got back pain or something, and this is very useful if, especially acupuncture, if they got like lower back, shoulder pain. Do you use different type of needles?
Yes.
Different kind of thickness,
We have
or
different needles. You know, the size is different.
depends on, yeah.
Yeah, it depends the patient. For example, if patient fatter, we use longer needles. Yeah. If patient skinny, shorter needles.
It depends on the size of the
Yes.
patient.
Yeah.
Okay.
I finish
Yeah,
the
that's good.
treatment. This here, the last two.
Yeah. There you go. So how long do you leave it in for, the needles for?
Normally,
patient?
like this, it's okay. This can help her blood pressure. Because the meridian flow for a circle
Yeah.
is around 28 minutes.
Yeah.
So normally we leave the needles in the patient's body, let patient have rest for 30 minutes.
For 30 minutes.
Just a circle.
Okay. Yeah.
Normally, for example, if for pain, shoulder pain, back pain, I never guarantee, but according my experience, when I put needles in, the pain at once reduce or disappear. So that's why more and more local people accept the acupuncture.
Okay, that's good. So we need to leave the volunteer for 30 minutes and enjoy him. So I'm sure he'll feel very relaxed after we leave. And personally, I found it really, really useful coming here and getting sessions done to you.
As a traditional Chinese doctor, when we graduated from a university, we must pass a strict test, examination. Yeah. You must can do it quickly, like painless.
Yeah.
So you can pass. If you make a patient very painful or you can't pass, you lost the examination. And recently, mostly I choose abdominal acupuncture because this treatment, like here, this is a new acupuncture therapy, and this is totally, safe, painless, high efficient. It's like this, even like 5 years, 10 years, this is small children.
So, so you just focus on the tummy area. That's, I mean, obviously this is where the muscles is, so people won't actually feel the needles going in. And this is what you're saying is everything stems from there. You know, nowadays I think, you know, gut is known as the second brain in a sense, but this is kind of similar to what you're saying, is that, you know, everything is stemming from here. You know, it kind of links to other parts of the body, and if you treat that area, you're most likely to find that people are actually much better in other parts. If they've got a lower, you know, upper back pain, headaches and things, you could actually treat it in that area.
It's true.
So
you know, this is the very basic. You know, every baby when they be giving birth in uterus of mom, from the belly button go to the nutrition and to all the body. Even be birthed, the system still exist, but not be used. What we use that stimulate the different meridian. It work properly.
Okay,
it work very quick and very safe.
Yeah.
No any side effects.
No side effects. That's a good thing. And know the side effects compared to, you know, medication that some people might be taking as well, in junction with what you're taking. But as you said, there's no side effects with that. So that's, I think that's the high on the list for most people. But I'd like to say thank you. I know I'm going to, you know, leave this volunteer because for 30 minutes and experience the effects of it. So, well, thank you for your time and showing us your clinic and give us some kind of, you know, showing us how acupuncture works.
Okay, you're welcome.
And where can people find you? You're in High Street, Glasgow, yeah?
Yeah, my clinic address is 300 High Street, Glasgow.
Okay.
Yeah, postcode is J40QN. If you Google my name or Google 300 High Street, Glasgow from internet.
So
find me.
300 High Street, Glasgow, and you've got a website that I'm sure, and you've also got a Facebook page as well.
Yes, I will pay Facebook. If people Google my name, easily can find me.
Well, thank you for your time, and thank you for, you know, giving us a chance to come in here and do the filming. And I'm sure a lot of people have actually benefited from just, you know, learning a bit about acupuncture and about the herbals as well. And I'm sure, you know, they'd be maybe thinking about what they want to try if you've got health challenges, and come along and to the clinic and have a try. Well, I hope you enjoyed this show today. I've definitely have learned something from today about herbals and acupuncture, and I hope you would love to hear from your any comments, and please put them in below and let us know. If you want to know, as I say, if you're in Glasgow, if you want to come along and have a try, it's 300 High Street. Dr. Leo will be happy to help you and assist you if you need a bit of advice about acupuncture. But I'd like to say thank you for everybody for watching my show every week, and I hope you're enjoying it. And it is all about making people feel good and look good, and today is about, you know, feeling good from the inside and out. So I hope you could join me next week in the next show, and please keep in touch on my pages. I'll be putting things up and letting you know what subjects I'll be talking about. If you got any topics that you want to know more about, please message me or put a comment below, and I'm happy to talk about that subject. So thank you for coming online and watching my show. Please share this video with many people as you can, and I hope to see you next week. Bye.
You can have a dream.